Hello, my name is Hamilton-Hackley, student nurse, and today I'm going to demonstrate and teach removal and application of the fentanyl transdermal patch. The fentanyl patch is an opioid drug, and it's used for patients who have a tolerance for opioids and chronic pain. The patch today that I'm going to administer is going to be 50 micrograms, and the patient is a patient with chronic pain. Hello.
Hello.
My name is Adrienne, and I'm your student nurse for today.
Nice to meet you.
Nice to meet you too. Would you please give me your full name?
Yes, my name is Jenna Johnson.
Hi, Jenna. So today, what I'm going to be doing is helping you with the administration of what we call the fentanyl patch, right? So the fentanyl patch is going to help you because you have chronic pain. And it is going to provide you with a continuous flow of medication. There are certain procedures that we're going to have to follow in order to properly administer the medication. And also at this time you currently have a patch on, so we're also going to remove the patch. Okay, so Jenna, the first thing that we want to do is we want to remove the patch that you currently have in place. All right. So in order to do that, it's always very important to wear gloves. Okay, so we're going to put gloves on. And prior to putting the gloves on, I have washed my hands. So you're always going to be washing your hands prior to putting on the gloves. Okay? So the next thing that I'm going to do is I'm going to remove the patch that's on there now. So you basically just want to gently remove the patch. Try not to tear it off. Okay, and what we're going to do is we're going to dispose of this patch, but before we do, we want to fold the patch in half. And we're going to fold it in half so that the medication is on the inside. All right. And when we dispose of it, we're going to dispose of it in a safe place that is out of the reach of any pets or any children. Okay? So the next thing that I'm going to do is I'm just going to wash that area with just plain water, and then I'm going to pat it dry. Okay? All right, so I'm going to remove my gloves. And then I'm going to wash my hands. And we're going to get ready to apply a new patch. So in process of applying the new patch, I'm going to wash my hands again, right? And then I'm going to put on some clean gloves. The new patch, Jenna, is going to be placed in an area that the patch was not previously put. So since it was on your right arm, we're going to apply the patch to your left arm. Okay? Prior to that, we always want to make sure that the fentanyl patch that we apply is the proper medication for you. So we want to perform our 5 rites. We want to make sure that this is the patch specifically ordered for you, that this patch is the correct drug, which is fentanyl, that it is the correct dosage, which is 50 microgram dosage, that it is indeed the patch, so we want to check the route, and we also want to make sure that we try to apply the patch consistently when it has to be applied. Okay, so if you apply it in the mornings, try to apply it in the mornings, so at the right time. All right, So what we're going to do here is we're going to wash the area. So I want to cleanse the area where the new patch is going to go. And then I want to pat the area dry. And the reason why I'm going to pat the area dry is because I don't want to create friction on the arm in the area where the patch is going to be. I don't want to apply heat, have any heat going to that area, right? So we want to pat it dry. And also we don't want to irritate that area of the skin. So I'm going to check this patch also for the expiration date. It's also very important to look for the expiration date on the patch. We don't want to apply any medication that is expired, all right? So we're going to tear it open. Now what you're going to find with the patch is that it's going to have paper that's protecting the sticky part of the patch. So in order to apply it, we're going to apply it to the left arm. We're going to remove half of the tape on the bandage and we're going to apply that. And then we're going to remove the other half of the bandage, of the tape patch. Okay, and we're just going to pat it, and we want to make sure that it's even, that it is free of folds, and it should be pretty even. Okay, and we're going to pat it, we're going to hold it for about 20 seconds. And then we're going to release it, okay? We're going to remove our gloves. And we're going to wash our hands, okay? And so the other important part about the patch is that you never want to cut open the package. So make sure that, you never use scissors when opening up the patch, because that could interrupt the medication that is going into your system, all right? So just always tear it open, all right? Do you have any questions about the application or removal of the patch?
No, I do not.
Okay. So what I want to do is I want to make sure that you're comfortable in the procedures for removing and applying. So I want for you to demonstrate that yourself, but I also want you to talk through the process with me. So I want to make sure that you can verbally say it and also demonstrate it. Okay?
Yes.
All right.
So, as I have the patch on, the first thing I would want to do is wash my hands, and then apply a pair of gloves. So first, to have the gloves on, we'll go into the patch and just gently peel it off. Okay. And we will fold it over so the two sticky sides are together. And then we will safely dispose of it somewhere out of reach of children and pets.
Yeah, very good.
And then after that, we can remove our gloves. And then wash hands. Okay. So to apply a new patch, again, I will start with washing my hands and apply your gloves. So for the new patch, patch, the application process, we're going to want to find a different area than our first patch was on.
Absolutely.
So I will put it on my right arm. So you're going to cleanse the area first, just with some plain water. And then to dry it, you just want to pat it dry instead of rubbing it to avoid irritation. Before applying, you want to check the drug, ensure it's the right drug, ensure it's the right dosage. Also check the expiration date. That does check out. So everything with this seems right. So now I can open this up. We're going to tear it instead of cutting it because I don't want to interfere with the patch, cut anything off that could interrupt the medication flowing into the system. So I'm gonna open this up. So to actually apply, what we will do is remove one side of the paper on the backing at a time. So take one side off and ensure that when you stick it down, you avoid as best as you can any wrinkles or bubbles in the patch. And then once one side is smoothly on, I can remove the other side and evenly apply it. And then I will hold this down for about 20 seconds just to make sure it's flat on the arm.
That's right.
So once it's firmly on, successfully, we can remove the gloves. And then again, following up with washing our hands to prevent any touching of the drug or anything that can harm us. And that's the process.
Jenna, that was excellent. And you demonstrated 100% the removal and the application of the fentanyl transdermal patch. So I know that before you had the patch, you were very concerned. And really, you were concerned about the patch itself, and you were concerned about being able to do that process, the removal and application. So after we've gone through this teaching, how do you feel now? Has your attitude changed any regarding how you can do this successfully?
I definitely think it's an easy process to learn now. It seemed a little stressful because there was a lot of steps, but it's much easier now that we've walked through it, and I've practiced it with you and had you here to walk me through the steps, and I'm very confident in reapplying and removing now.
Absolutely. And the transdermal patch, it should be reapplied every 3 days. So you're going to keep the patch on, and then every 3 days you'll remove it and put on a new patch. And if you have any concerns, you always call your doctor. I also want to make sure that you are aware that if there are any adverse reactions, and by adverse reactions, if you have any problems with your respiration or breathing, if you are hyperventilating, if you seem to have hallucinations, you're seeing things that you shouldn't see, confusion, chest pain, nausea, muscular weakness, or a loss of appetite. Those are very serious reactions, so that you should contact your physician. There are some other side effects that you might also encounter, which are not as serious, and those would be fatigue, irritability, diarrhea, joint pain, and trouble sleeping. So those are a few things that are more common. But again, if you have any questions, you always want to make sure that you notify your physician, okay? So thank you very much, Jenna, for participating in this teaching application today.
Thank you.
And that is the end of the teaching video for the fentanyl transdermal patch. Thank you.